Hi friends, welcome to the channel The Nurse. Here we are discussing about there are 15 questions for preparing upcoming CE3 hospital exams that is scheduled on 8th of January 2023. So these questions are divided into mainly 3 to 4 subjects, that is OBG, nursing management, first aid management. These are the main topics. So we will go to the topic question and answers. Before that, if you are not subscribed to our channel, please subscribe. So we will move to the questions, nursing questions and answers. That is 2023, our first video. First question. That is first question is from nursing research topic. What is the purpose of nursing research? Basic questions from nursing research. To generate new knowledge about nursing practice, to replicate the results of previous studies, to test hypotheses about nursing practice, all of the above. Purpose of nursing research. Correct answer, all of the above. So we will discuss in details. Nursing research, that is the purpose of nursing research is to generate new knowledge about nursing practice. So nursing research, it is to generate new knowledge about nursing practice, replicate the results of previous studies and test hypotheses about nursing practice. So these are the main purpose for nursing research, to generate new knowledge and replicate the results of previous studies and test hypotheses about nursing practice. Nursing research helps to advance the field of nursing by identifying best practices, evaluating the effectiveness of interventions, and addressing the gaps in knowledge. So sometimes in your for an example, COVID comes. So most of the time, in the initial the management at the time of early 2020 January February time, there were confusion about how to tackle the situation, how to tackle the spread of COVID-19. So there will be some adaptation we have taken because of some research they have done in within short period, and they have adapted the use of personal protective equipments and the specialized mask like N95 mask. So these are the some advanced methods we are implementing with the help of nursing research, and also we are filling the gaps that is lack of knowledge in some topics, so that in the continuous nursing research will do about that topics and fill the gaps. So these are the purpose for nursing research. Next question, which of the following is not a characteristics of a well conducted nursing research study? The study is well funded, the study is ethical, the study is methodologically sound, the study has a large sample size. So here correct answer is the study is well funded. So funding is a supportive only. So it is not a characteristic feature of well conducted nursing research study. So that we will discuss in detail. While funding is important for supporting the nursing research, it is not a characteristics of a well conducted study. So we will see the what are the things needed for well conducted study or characteristic features of a well conducted nursing research study. So that includes ethical, methodologically sound, and has a large sample size to get a correct or more accurate results. Ethical consideration includes the first characteristics, that is ethical. So ethical consideration includes obtaining informed consent from participants and protecting their privacy and confidentiality. That is what ethical consideration explaining. Same time, methodologically sound means it refers to the use of rigorous research methods and the appropriate statistical analysis of data. So each and every nursing research needed a specific kind of nursing method, research methods, or it requires a specific analysis data. So these are includes under methodological soundness. Then third one, that is large sample size that increases the power of the study and increases the likelihood of finding statistically significant results. So the sample size, if it is increasing, the results, the accuracy of the results will be more. There is a fact there will be it will take more time, but still the results will get more accurate. If sample size is large, the results will be more accurate. So third question is, what is the process of reviewing and evaluating nursing research known as? Peer review, literature review, meta-analysis, systematic review. Correct answer is peer review. The process of reviewing and evaluating nursing research is known as peer review. Peer review is the process of reviewing and evaluating nursing research by a panel of experts in the field. So, the panel of experts that they will review the nursing research of the student, and they will evaluate whether it is done in a proper systematic way. The results is giving a genuine result, whether it is a genuine result, or they will evaluate with their knowledge, the expert knowledge. They will use their expert knowledge in that particular topic. Peer review helps to ensure the quality and rigor of nursing research by providing an objective evaluation of the study's methods and finding. So the quality depends upon the experts reviewing. So if they required, they will give corrections and they will again review it. If any problem is there, means they will give corrections and they will again review. So that will improve the quality of the nursing research. Other process for reviewing nursing research include literature review, meta-analysis, and systematic review. A literature review is a summary of research on a specific topic, while a meta-analysis is a statistical analysis of multiple scientific studies. So these are the terms related to nursing research studies: peer review, literature review, meta-analysis, etc. Then fourth question, what is the role of nursing researcher? To conduct research studies, to publish research findings, to disseminate research findings to other healthcare professionals, all of the above. So here correct answer is all of the above. To conduct research studies, to publish research findings, to disseminate research findings to other healthcare professionals, all are the roles of the nursing researchers. The role of nursing researchers is to conduct research studies, publish research findings after peer review, and disseminate research findings to other healthcare professionals. So it will make a bridge between other departments. And nursing researchers play a critical role in advancing the field of nursing by identifying areas of need, designing research studies, collecting and analyzing data, and sharing their findings with others. So that is the main purpose of the nursing research. It will help to advance in the field of nursing, and it also helps also helps to identify the need of designing nurse studies. So in some area it requires more research to make it better. So that and all, it is the role of nursing researchers to do a deeper research work. Fifth question, which of the following is not an example of a nursing research question? So in this question, you need to focus each and every word of the question. Then only you can answer correctly. What is the, so I will read the options of questions. What is the impact of nurse-led discharge planning intervention on patient satisfaction and rehospitalization rates? How does the type of feeding tube used for critically ill patients affect their rate of complications? How does the use of social media impact the mental health of college students? What is the prevalence of diabetes among adults in India? Here, the correct answer is, how does the use of social media impact the mental health of the college students? So in first question itself, I have explained that nursing research that is focused on implementing or advancing the nursing profession. or related to nursing or related to patient care improvement. So here, how does the use of social media impact the mental health of the college students? That will not directly affect the nursing profession or patient care. It will be useful in the case of identifying mental health of the college students. How social media affects the mental health of the college students. So that is why it is wrong. So it is not considered as a nursing research question. It can consider other departments for research purpose, but it is not a question for nursing research question. That is what I told to focus on the question. While the use of social media may have an impact on the mental health of college students, this is not a nursing research question. Why? It is not related to improving nursing professions or it is not related to patient care, directly related to the patient care or improvement or interventions required to improve the patient care. A nursing research question should focus on an issue that is relevant to nursing practice and is related to improving patient outcomes or advancing the field of nursing. Examples of nursing research questions include the impact of a nurse-led discharge planning interventions on patient satisfaction and rehospitalization rates. That is the first option. The effect of the type of feeding tube used for critically ill patients on the rate of complication. That is the third options. And the prevalence of diabetes among adults. That is the fourth options. So these are the examples of nursing research questions. Sixth question. Which of the following is or are a common complication of pregnancy? Hemorrhoids, constipation, urinary tract infection, all of the above. Correct answer is all of the above. So here we are starting OBG questions. So what are the common complications of pregnancy? That is includes hemorrhoids, constipation and urinary tract infections are all common complications of pregnancy. Hemorrhoids means a swollen veins in the rectum or anus that can cause discomfort and bleeding during the time of defecation. Constipation is a common problem during pregnancy that can be caused by changes in the hormone levels and the pressure of the growing uterus on the intestine. Same time, urinary tract infection is an infection that affects the bladder, urethra or kidneys and it can cause pain or discomfort while urinating. So these are the common complication during the pregnancy. Seventh question, it is also from OPG. What should a pregnant woman do to prevent risk of developing a urinary tract infection? So in previous question we have discussed about common complication of pregnancy. So what are the intervention needed to prevent the urinary tract infection in the pregnant woman? Avoid using the bathroom for long period of time. Drink plenty of water. Wipe from back to front after using the bathroom. All of the above. Here correct answer is option B. Drink plenty of water. So it will reduce the occurrence of urinary tract infection. Drinking plenty of water is an important way to prevent the risk of developing a urinary tract infection during pregnancy. Not only during the pregnancy, you can drink more water during the other normal period also. It will reduce the occurrence of urinary tract infections. Staying hydrated can help to flush out the bacteria and keep the urinary tract healthy. It is also important to wipe from front to back. In option, it is mentioned back to front, but we should wipe the that perineal region, that is from front to back after using the bathroom to prevent the spread of bacteria and to avoid holding in urine for long period of time. So whenever if you felt for urination, you have to use the bathroom and no need for holding for longer period and wiping from front to back. Eighth question. What is the recommended weight gain during pregnancy? So usually we will get questions from that is given in kilogram. So I purposefully made in pounds. So you need to answer. 10 to 15 pounds, 15 to 20 pounds, 20 to 25 pounds, 25 to 30 pounds. The normal weight gain during the pregnancy, that is 20 to 25 pounds, that equals to 10 to 11 kilogram during the entire pregnancy period. The recommended weight gain during pregnancy is 20 to 25 pounds, that equal to 10 to 11 kilogram. This is based on the women's body mass index before pregnancy. If the women is in underweight, that women need to gain weight more, while women who are overweight may need to gain less weight. It is important for pregnant women to eat a healthy diet and engage in a moderate physical activity to ensure that they gain the appropriate amount of weight. So the weight gain should be adjusted according to the their body weight. So if women before pregnancy, if she is underweight, she has to get more weight during the pregnancy time. If the patient is overweight before the pregnancy, that woman has to get less weight during the pregnancy time. Ninth question, which of the following is a risk factor for preterm labor? Having a multiple pregnancy, being over the age of 35, having a history of preterm labor, all of the above. Correct answer, all of the above. Having a multiple pregnancy, being over the age of 35 and having a history of preterm labor are all risk factors for preterm labor. So these are the risk factors for preterm labor. Preterm labor is defined as labor that occurs before 37 weeks of pregnancy. So after 37 to 40, it should be a term labor, normal delivery, and before 37 weeks, it is called as preterm labor. Preterm birth can increase the risk of health problems for both mother and baby. Because there will be lack of maturity, lung maturity. So these are and heart problems. These are the common in preterm baby. So and same for mother also. Mother also will get health problems related to the preterm delivery. Risk factors for preterm labor include carrying twins or triplets or more, being over the age of 35, having a history of preterm labor or preterm delivery in previous delivery, having certain medical conditions such as diabetes or high blood pressure. That also contribute risk factors for preterm delivery or preterm labor. It is important for pregnant women to discuss any potential risk factors with their healthcare provider to ensure that they receive the appropriate care. If the pregnant woman has any of these risk factor is there, means that woman has to inform the doctor early. Then the doctor will take adequate measure for preventing preterm labor. 10th question, what should you do if you are bitten by a venomous snake? Try to catch the snake and bring it with you to the hospital. Cut the bite wound with a knife to remove the venom. Apply a tourniquet to the bite wound. Remain calm and seek medical attention immediately. So if you bitten by a venomous snake, what should you do? What should you do? So here correct answer is remain calm and seek medical attention immediately. If you are bitten by a venomous snake, it is important to remain calm and seek medical attention as soon as possible. The best time, that is 30 minutes to reach the hospital. Do not try to catch the snakes or cut the bite wound, as these actions can be dangerous and may cause further injury. So don't try to catch the snake or make additional injury or cut the wound. Same time, avoid applying a tourniquet. If you are not a healthcare provider, if you are not that much skilled to apply tourniquet, so do not apply the tourniquet. There is a method for applying tourniquet. So if you don't know, you should not do the tourniquet. Avoid applying a tourniquet as they may restrict the blood flow and cause tissue damage. The Australian pressure immobilization bandage method is only recommended for bites by neurotoxic snakes that do not cause local swelling. So if you are a healthcare provider or you are skilled to apply a tourniquet, so you should do a Australian pressure immobilization bandage. I will show you the example picture, then you will understand what is Australian pressure immobilization bandage. So that will reduce the spread of venom. Instead of seeking medical attention, immediately and follow any instructions provided by healthcare professionals. So if you call an ambulance and there is a healthcare professional is there, means they will give instructions what to do and what do not do. So you should follow the instructions. So there are certain criteria given by WHO for the first aid management of venomous snake bite. So that includes immediately move away from the area where the bite occurred. First we need to do, if the snake still there, means you should move away from the that area and stay calm, because further movement will also increase the blood circulation. So keep away and stay calm. And if the snake is still attached, that is still bitten on that area and attached there, then you need to use a stick to remove the snake. And if you are bitten by a sea snake, the victim should be taken away from the water. Otherwise, there will be a drowning. So, if snake bite bitten means you need to take the victim away from the water. Then remove anything tight from the wound, wound or bitten part, because some snake bite may cause area swollen. So that will further deteriorate the blood circulation into the distal part. So you need to remove the any tight ornaments or dress from the affected part. And next thing is reassure the victim. So that will be a very important thing. If patient usually patient will that victim will be panic situations, and it will increase the blood circulation and spread the venom to the heart and lungs or more systemic circulations. So in that case, you need to reassure the victim and keep him calm. So in usually some many of the times it will not cause a death. Usually with the treatment we can save the victim, and many a time it will be it will not cause that much venom inside the body. So like that we need to reassure the victim. And another thing is splinting the area or splinting the bitten part. So that will prevent the moving of the bitten or wound area, and it will reduce the circulations. So splint with either we can use Australian pressure immobilization bandage or any other hard items. And while using the tourniquet, never use a tight arterial tourniquet. Australian pressure bandage, it is recommended if it is a neurotoxic snakes. Applying pressure at the bite site with a pressure pad may be suitable in some cases. Sometimes we can apply the pressure bandage with any folded linen or anything. We can bandage the wound area. And always remember, our traditional first aid methods, herbal medicine and other unproven or unsafe forms of first aid. Transport the patients to a health facility as soon as possible. Paracetamol may be given for local pain. Vomiting may occur, so place the person on a left side in the recovery position. Closely monitor airway and breathing, and ready to resuscitate if necessary. So these are the points or first aid management interventions given by WHO if there is a venomous bite occurs. You can go through the details. So just for your information, I have told, because earlier we have directly applied the tourniquet. So while applying tourniquet, it should not constrict the arterial supply. That is the important thing. That is why I explained everything that is given by WHO. So this is the example of Australian pressure immobilization bandage. So like this, we need to immobilize the area. If the bitten area is in leg, so you should apply bandage like this, or bitten area on the hand or any other part, you should apply the pressure bandage like this. So it should not constrict the arterial circulation. That is the important thing. 11th question. What should you do if you are unable to reach medical attention within 30 minutes of being bitten by a venomous snake? Try to catch the snake and bring it with you to the hospital. Cut the bite wound with a knife to remove the venom. Apply a tourniquet to the bite wound. Stay still and keep the affected limb immobilized. Here correct answer is option D. Stay still and keep the affected limb immobilized. Immobilization technique I already explained. So if your transportation delayed more than 30 minutes, you should immobilize the patient, and you can also apply the Australian tourniquet method, and always keep the bitten part below the heart level. So that also will reduce the circulation to the heart, or system that will reduce the venom reaching systemic circulation. If you are unable to reach medical attention within 30 minutes of being bitten by a venomous snake, it is important to stay still and keep the affected limb immobilized. This can help to reduce the spread of venom through the body and may help to minimize severity. So if it is spread systemic circulation, means it will cause more problems. So usually viper will affect the nervous system. So like that, it will cause respiratory paralysis and kidney failure. These are the symptoms of snake bite. So if you are delayed the getting the antivenom administration, means you should keep the patient immobilized and stay calm. Then 12th question. What should you do if you are bitten by a non-venomous snake? Apply a tourniquet to the bite wound. Cut the bite wound with a knife to remove the venom. Wash the bite wound with soap and water. Seek medical attention. So first intervention will be wash the bite wound with the soap and water. It will reduce the sepsis, because even if it is non-venomous snake, there will be lot of dirty other bacteria and all in their saliva. So it will go into the wound, and it will cause sepsis if it is untreated. So wash the bite wound with soap and water first, then seek medical help. The second thing is going hospital. First, we need to wash the area properly with soap and water. If you are bitten by a non-venomous snake, it is important to wash the bite wound with soap and water to prevent infection. Do not apply a tourniquet or cut the bite wound, as these actions can cause further injury. You may also want to seek medical attention, particularly if the bite is deep or you are concerned about the risk of infections. Even it is non-venomous snake, you need to go to medical. You need to get the medical help if it is deep wound. Then 12th question. How can you prevent snake bites? Wear bright colors. Carry a snake with you at all times. Avoid areas where snakes are known to live. Play loud music to scare snakes away. So what you will do? So correct answer is avoid areas where snakes are known to live. To prevent snake bites, you need to avoid the areas. So one of the most effective ways to prevent snake bites is to avoid areas where snakes are known to live. So you need to know in which place snakes will be there. So usually snakes are seen that is in tall grass areas. There will be a tall grasses or piles of leaves or debris. In waste materials are piled in an area, and there is a most chance the snakes will come to uh, catch the prey like rats or some other insects, and other hiding places like below the stones or some wooden parts. These are the common areas of snakes living areas. So you need to avoid the area. Then only you can prevent the snake bites. You can also take the other precautions such as wearing protective footwear. If you are going, still you want to go the particular risky areas, you need to wear a protective footwear and carrying a snake bite kit to reduce the risk of being bitten by a snake. Wearing bright colors, carrying a snake with you, and playing loud music are not effective method of preventing snake bites. Then 13th question, what is the primary role of a nursing manager? Providing direct patient care, hiring and firing staff, developing policies and procedures, managing the budget and financial resources. So here correct answer is a nursing manager's role includes developing policies and procedures. The primary role of nursing manager is to develop policies and procedures, plan and coordinate care, and oversee the overall operation of the nursing unit. While they may be involved in hiring and firing staffs and managing the budget, these are not the main focus of their role. So during their duty, it will occur, but it is not a primary focus of the nursing manager's role. 14th question. A nursing manager is reviewing the staffing levels on the unit and notices that there are not enough nurses to provide adequate patient coverage. What is the first step the nurse manager should take? In your working area, for a particular day or for some days, there will be less staff. So you are a nursing manager, what you will do? So think about and comment it. So here options are requesting additional nurses from the staffing office, that is nursing office, asking the current nurses to work overtime, reassessing patients to reassigning patients to other units, implementing a hold on new admissions. So which will be the correct options? As a nurse manager, your primary intervention or primary role, that is requesting additional nurses from the nursing office. The first step the nursing manager should take in this situation is to request additional nurses from the nursing office or staffing office to ensure that there are enough staff members to provide adequate patient coverage. While the other options may be necessary in the short term, but they do not address the underlying issue of the inadequate staffing. For a short period of time, that overtime and all will be effective, but it is not a permanent solution. Then 15th question, that is the last question today. A nursing manager is working with a new graduate nurse who is struggling with the time management and prioritization. What is the best course of action for a manager to take? Providing additional training on time management and prioritization skill, assigning the nurse to work with a more experienced mentor, increasing the nurse's workload to help them learn to manage their time better, documenting the nurse's performance and issuing a warning. So which will be the correct answer? Correct answer is assigning the new nurse to work with a more experienced nurse or mentor. So that is the correct method. Correct method of a nurse management role. If a new nurse comes, means the nurse manager has to put with the experienced staff, then that nurse will learn from there, then only assign independently. The best course of action for the nursing manager in this situation is to assign the nurse to work with a more experienced nurse or mentor. This will allow the nurse to learn from someone with more experience and get guidance on how to manage their time and prioritize tasks effectively. While other options, that is additional training and increasing the workload, may be useful in the long term, working with a mentor is likely to provide more immediate and targeted support. So that's about today's questions. So 15 questions we have discussed it today. that is from nursing research top subject, and OBG, then first aid management of snake bites, and finally we have discussed some questions from nursing management. So if you like the video, means you just press the like button, and also you share with your friends. So thank you for watching this video. Bye bye.